Hi, everybody. We're joined now by Dr. Heath Turnquist, who is an associate professor of surgery and immunology with the University of Pittsburgh School of Medicine, and specifically, he works in the Starzl Institute for Transplantation Research. Welcome, Dr. Turnquist.
Yeah, thanks, Greg.
So, I met Dr. Turnquist a few months ago. I was very lucky to be able to tour some of the research facilities at the Starzl Institute. And as a transplant recipient, it was really amazing to kind of see the background work on some of the terms and some of the medicine and things that I interact with on a daily basis as a transplant patient. They're really doing tremendous work up there and trying to take the transplant world for recipients and everybody into the next generation. So, Dr. Turnquist, can you just tell us a little bit like your background and how you came to be working with the Starzl Institute?
Sure. Um, I got my PhD in 2005, and that was in tumor immunology. And at that time, there was these regulatory cells that had just recently been identified that really seemed to be shutting down the anti-tumor response. And I got really interested in those cells. And it seemed like the transplant community was actually, had doing a really good job of characterizing them and trying to apply them as things like cell therapy to, reduce the need for immunosuppression or to induce tolerance. So that really got me interested in going to work in transplant. And so I came to the Starzl Institute in 2006, and where I worked with investigators here, Dr. Thompson, just really trying to learn what we can about these cells, the mechanisms they use to suppress. And that opened up the line of investigation that allowed me to then start my own research group here at the Starzl. And so we still really focus on these regulatory or reparative cells. And what we've found over the last few years is that, people have known for some time that they're very good at suppressing the immune system, but they also appear to be very good at mediating tissue repair. And so a lot of our recent work then has shown that these cells called T regulatory cells then can act on myeloid cells such as reparative macrophages. And these are also the ones that become inflammatory and then cause tissue damage. And so what we really looked at is this interrelationship between these T regulatory cells and the macrophages, as well as like the repair signals, the regulatory signals they're receiving. And so we've identified one that's very important early on to shape this reparative and regulatory function in these cells. This is called interleukin 33. And so that's been a lot of our work. And so we've just published a really important paper showing that IL-33 comes out of the graft to keep macrophages, myeloid cells, when they're coming into the graft, calm, so they don't really become super inflammatory. In the absence of that, they become very detrimental to the graft, and they can cause acute graft rejection. And so what we've also then taken that knowledge, we can show that we can package up IL-33 in little particles. We delivered it at the time of heart transplant, and that was very impactful in that it reduced these inflammatory cells, and then that went on to prevent chronic rejection. So we're really excited about these findings, and so a lot of our goals right now is to see if we can translate this into the clinic, but then also we're trying to develop like cell therapies where we can expand these reparative cells to hopefully deliver more of them at the time of transplant, and so really benefit the transplant recipients. That's a lot of what we're doing, and I guess that's kind of how we started and where we're at right now in a nutshell.
Yeah, that kind of leads me to my next, I think looking around the medical community, we've seen, it seems like things are advancing at today's age much rapidly and on an exponential stage. I know for me, I had an LVAD for a year and a half before my transplant, and they've only been around for 20 years, maybe something like that. So, how much has the transplant community changed just in the last decade or 20 years from where we were with this type of research, and how much of a difference that has meant, when you get down to the baseline, when you get down to the clinical work and the patients that have transplants.
Right. And so, I think we've been really good at immunosuppressing people for a long time, right? And there hasn't been a whole lot of change there. We're still using a lot of the original immunosuppressants. Where I always see things moving is, how do we give people a better graft at the start point, right? Like, how do we reduce ischemia, reperfusion injury? I think this is where our research is kind of starting to come in, and hopefully we can make an impact there. Is like, how do we, get that graft off to the best start? Because there is lots of evidence that if, the more tissue damage, the more ischemia, reperfusion injury, the more rejection you have, the worse outcomes, the more, shorter long-term graft survival. And so, our goal, and I think a goal of a lot of people is like, with things like ex vivo perfusion, where if, you can perfuse a graft to get it really nice and functioning, so there's less of ischemia, as well as can we target some of these reparative pathways while blocking inflammatory pathways, just give that person the best start they can. So I think that's, probably one thing that's going to change in transplantation. And then I do feel that, some of the tolerance protocols, while still very aggressive, they involve a lot of preconditioning of the recipient, bone marrow transplants. But, as we understand really, all right, well, we just need this, we don't need this. Hopefully, those protocols will become less rigorous, and then more widely applicable. And hopefully we can, limit the amount of immunosuppression people need. And I guess another area that I think is, doesn't get enough attention, that's, I think transplant's really doing a good job, is probably these biomarkers, or just ways to screen people to say, it used to be, you just do a biopsy, you see inflammatory cells there. But now people are using, transcriptional analysis, proteomics, circulating blood markers to really get a feel for like, all right, what's the status of this patient? What's the status of the graft? Can we decrease the immunosuppression? Are they undergoing rejection, or is it an infection? And I think that, that'll really help people be able to treat transplant recipients.
Yeah, it's kind of a balancing act for a patient, who wants to, you definitely don't want to say who wants to be the guinea pig, but it's a balancing act of, working to get people off of those immunosuppressants because of the side effects that they entail, but also making sure that they don't experience rejection. So, I know my team and any other recipient, their doctors' teams, they really have to kind of weigh those pros and cons and make sure that they get them on a good regimen of medication. So it's really exciting to hear that maybe someday, that might not even be a necessary thing when it comes to transplantation. But, the Pittsburgh, I think many people take Pittsburgh for granted as far as its role in medical research and medical advances. The Starzl Institute, where you work, is obviously named after Dr. Thomas Starzl. We had the good fortune of talking to his wife, Joy, and hearing some of those early stories. And University of Pittsburgh has been right at the forefront of transplantation for a very, very long time. And you guys are continuing that. So, it's always hard to peg down timelines and where you see the future of medicine, but what do you kind of think? What's your hypothesis on, 10 years from now, 20 years from now? What's a realistic expectation for the transplant world?
That's a tough question. I guess where I could see, really improvements being made are like just the ability to, more actively monitor and dynamically treat patients, right? And I think one thing, I just feel like transplant centers are doing a better job of doing big studies where they can look at a lot of data, a lot of different patients. And people, I think here at the Starzl, as well as other places, are using things like artificial intelligence, math modeling to really look through these big data sets. Like, all right, look at this marker, look at this group of patients that did really well versus ones that did poorly. I think with that, you really can shape like, all right, its own personalized medicine in transplant, I think will be somewhere where we're at probably in 2020, or excuse me, 20 years from now, 20 years from 2020. I guess, I do think giving people better grafts with the goal of, okay, we're going to make this graft survive, hopefully for the life of the patient. And I think a lot of that starts with just giving them the best graft possible. And, maybe that will be, all right, we just need to do less ischemia reperfusion injury. Or alternatively, maybe, this is coming from not an ideal donor. Can we reprogram this graft a little bit to, decrease inflammation, reduce, is there a pro-inflammatory subset of immune cells that's coming with it? How do we modify the graft to improve outcomes? And I think that's something else that, we'll be able to do 20 years from now or so.
Yeah, I mean, the research is going to be so important, as it always is. And, one thing you have to keep in mind when it comes to this basic science research is, there can be great progress made without some huge booming announcement that seems like a major breakthrough. It's kind of a building block. You're building the foundation for more research in the future that's going to make these changes and make everything better for transplant patients. So, aside from the research, I think I can echo pretty much anybody in the transplant community's sentiments when we say the biggest difference people can make is just signing up to be an organ donor. We have 113,000 people in the country right now that are on that waiting list, and there's a shortage, and it's a huge problem in this country. So, we always encourage everybody to find out more about organ donation. Visit the OPO's website. That's core.org. You can sign up there. You can ask questions. Please reach out to us with Second Chance Fundraising. We're always willing to have those conversations and let you know what's going on. So, Dr. Turnquist, it was really great to see you again. And thank you for coming and joining with us and sharing some of the great research you guys are doing.
Thanks. My pleasure. And congrats on 5 years.
Thank you.